Chair now recognizes Mr. Garcia from California.
Thank you, Mr. Chairman. I want to first begin by thanking all of our witnesses for being here and for your testimony, obviously for all the comments that we've heard here from both sides of the aisle in the committee. I do think that it's ironic that we're holding a hearing on restoring the trust in the FDA while we're ignoring the single biggest threat to public health today, which is, of course, Donald Trump's health secretary, Robert F. Kennedy Jr. Now, together with Elon Musk, RFK Jr. is actively undermining the institutions that protect public health and the safety of all Americans. Now, we know that RFK Jr. already has a history of outrageous medical opinions and a dangerous anti-vax record. Now, let's just look at the measles alone. Before the measles vaccine, we know that measles would kill 400 to 500 American children annually. Now, after, of course, that vaccine was released, that number fell to almost nothing. But now, with RFK's anti-vax movement growing and his dysfunction at HHS, we've seen over 600 confirmed measles cases across 22 jurisdictions, and that, of course, is not a coincidence. We also know that this is also just the beginning. This committee is not serious about actually taking on the public health threat of measles, which, by the way, our measles cases today is 50 times higher than we have trans athletes in college sports, yet they obsess about that every single day. The committee is obsessed with things that don't matter, but not the public health of actual Americans and children. But by the way, children are now actually dying. And we know that, of course, that's just the beginning. RFK Jr. has said that 5G and Wi-Fi can cause brain damage, ADHD, radiation sickness. He's said that pesticides are actually turning people transgender. He's even questioned whether HIV causes AIDS. He's made comments, of course, that alkyl nitrite, better known as poppers the sum, is the actual cause of AIDS. He said during a campaign event that 100% of the people who died, the first 1,000 who had AIDS, were people who were addicted to poppers. In his 2021 book and 2023 interview with the New York Times and New York Magazine, he repeated claims that question the causes of AIDS despite overwhelming evidence to the contrary. In my opinion, RFK Jr. has been and will always be a tinfoil hat conspiracy theorist. He should be anywhere near HHS, medical opinion, and our research in this country. Now, Dr. Kessler, I hate to have to even ask you this, but is there any serious medical evidence that HIV does not cause AIDS?
No.
Thank you. And that's exactly why these cuts by DOJ and RFK Jr. to HIV research, treatment, prevention are so dangerous. Public health experts warn that these actions will set us back decades. Now, despite Donald Trump's 2019 State of the Union promise to end the HIV epidemic, we've seen over $800 million in HIV research actually cut. HHS, the Office of Infectious Disease and HIV policy has been shuttered. CDC surveillance efforts have been gutted. PEPFAR, the Global Fund, all, of course, life-saving initiatives are being dismantled. Now, Dr. Kessler, you led the effort to fast-track approval for life-saving AIDS programs. Can you just briefly, in a sentence or two, explain how DOJ is going after the work?
I also chaired the board of the Elizabeth Glaser Pediatric AIDS Foundation. With President Bush, the son, right, that was, the goal was to stop mother-to-child transmission throughout the world of HIV. It was the moral conscience of this nation, right? Global health relies on America, and that has been drastically cut.
That's absolutely right, sir. And we also know that RFK Jr., while this is happening globally and here back home, he's fired 10,000 people from his agency and then claimed that 2,000 of those was actually a mistake. So firing people, claiming they're a mistake, gutting the agency, taking away support from life-saving programs, spreading anti-vaccine conspiracy theories, that's what RFK Jr. right now is all about. And these aren't just mistakes, these are life or death decisions. Critical staff have been lost. Experts overseeing medicines, food safety, and medical devices, as we know, have been shut or let go, and we're incredibly concerned. I want to read this quote by former FDA Commissioner Robert Califf. Quote, "The FDA, as we've known, is finished. With most of the leaders, institutional knowledge, and a deep understanding of product development and safety no longer being employed, It is totally unacceptable that Congress is doing nothing to prevent, of course, this absolute destruction of our public health infrastructure. We need to stop this now. And with that, I yield back.
Gentlemen, yield back. I just have to comment, Mr. Garcia, in all good faith. The predecessor for the ranking member, Mr. Raskin, said that those of us who wondered if COVID came from the lab at Wuhan, we were conspiracy theorists. And when we started suggesting that maybe former President Biden was in mental decline, that we were conspiracy theorists. And now, there's just books coming out by all these Democrat journalists every day saying what we had wondered too. I'm not defending or trashing what you said about Robert F. Kennedy. It's just that conspiracy theories are in the eyes of the beholder. So,
Sir, do you think that children should be getting the measles vaccine?
That
That children should be receiving the measles vaccine?
all my children are vaccinated.
And do you think that we should be getting vaccinated for COVID?
Well, I think there's a lot of questions about COVID that we need answered. But measles, yes.
And
I recognize this.
And again, our current HHS secretary is a anti-vax conspiracy theorist, and that is a fact. He caused a measles outbreak in another country that caused the death. Absolutely, that caused.
No, he did not.
He absolutely did.
That's a lie.
That is a proven
RFK
fact.
did not cause a measles outbreak.
Miss Greene,
you sound
Miss
ignorant.
Green, you are an
That's
anti-vax.
ignorant,
You're
and that's
an
a lie.
anti-vax conspiracy
no, I'm
theorist
for
yourself.
choice. I'm
You're
for
the
parents
number one
and people
anti-vax
choosing.
conspiracy theorist.
That was my fault.
Choosing.
Mr. Chairman, am I
Vaccines kill
recognized? Am I recognized? Mr.
Our
Chairman?
witnesses were snoozing, so I had to spice it up a little bit.
Wake up.
Chair now recognizes Ms. Stansberry from New Mexico.
Thank you, Mr. Chairman. I just want to ask a quick question. This is the Oversight Committee, correct? Mm-hmm. That's right. We're in the Oversight Committee. So I have to say I found this to be a very bizarre committee hearing, because here we are in oversight, and our job is to conduct oversight over the administration because of the separation of powers between Congress and the executive branch. And right now, the administration is dismantling the Food and Drug Administration. And we are sitting here, and members on both sides of the aisle are asking questions of industry-funded groups about how the FDA is going to protect public health from medicines and food, while the secretary is firing thousands of FDA employees. In fact, just this last week, they announced they were firing 3,500 members of FDA, and RFK Jr. announced that he was going to fire 10,000 HHS employees across the entire agency. So my question is, if this is the Oversight Committee, why are we not conducting oversight over the administration and their mass firings and the actual deconstruction of the exact agency that's supposed to protect the public health? That is what we should be doing right now in this hearing room. So I find it very bizarre that many of my friends across the aisle are asking, how these folks are going to protect the public health, because they're not, because they're dismantling and taking out the top experts who do this work. Now, some of my colleagues have already pointed out that one of the top vaccinologists, not just in the United States, but in the world, Dr. Peter Marks, was forced to resign. And in a few moments, I'm going to enter his resignation letter into the record, because it's instructive. In his resignation, he says that for the last 13 years, he's tried to ensure the efficiency and effectiveness of the science and the public health. And he says at the end of his letter, however, it has become clear that truth and transparency are not desired by the secretary, but rather he wishes subservient confirmation of his misinformation and lies. I've been trying to figure out for the last couple of weeks what exactly the end goal is inside of HHS, what exactly the end goal is inside of FDA, what exactly the GOP's theory of MAHA, of Make America Healthy Again, is. Because today you want to take a vote on dismantling Medicaid. Your president is mass firing thousands of public health officials, including the people who make our drugs, our medications, our food, our cosmetic safety. Your president has announced yesterday that he wants to put tariffs on pharmaceuticals, and you're going after Social Security and Medicaid by dismantling the offices and the services and programs through DOGE that actually serve the people of this country. So I don't understand it. I don't understand how this serves the public interest. Dr. Kessler, I am very grateful that you are here today. You are a legend. You are so well known across the public health space, and I know you're not currently serving in this administration, but help us understand the scope and the scale and why the American people need to be paying attention to what's happening inside the agency right now.
20 cents of every consumer dollar is spent on a product that FDA oversees. All our foods, essentially, right, except meat and poultry, USDA does that. All our drugs, all cosmetics, our blood supply, our medical devices, our radiological, many of our radiological devices. The agency is absolutely essential for the safety of the American family. Right? It's also absolutely key for our competitiveness. Right? I mean, I am concerned, right, that China's going to beat us scientifically, you know, if we're not careful with all these cuts that are going on. But the reason I'm concerned about that, it's not about China. It's about the health of us.
And Dr. Kessler, I want to end with this note. As Vera Rosenthal was leaving the department after being fired by the secretary, she said, people are going to die from these cuts. I am not being an alarmist. The day after they announced these mass firings and cuts, pharmaceutical prices tanked on the market, and that was before tariffs. And that's because the ability to get life-saving drugs to market, the ability to save American lives, the ability to get
The gentlelady's time has expired.
to our people.
Gentlelady's time has
depends
expired.
on having a functioning.
Gentlelady's time has expired. I now
And
recognize
are going
Mr. Higgins
to
from
die
Louisiana.
If they do not have the
The
public
gentlelady's
health
time has
protected.
expired.
I am
The
sorry,
gentlelady's
Madam
time has
Chairwoman,
expired.
But the American people
The
need to
gentlelady's time has
understand
expired.
what is happening
Miss Stansberry,
inside this
Miss
agency
Stansberry, the
and
gentlelady's
risks to
time
the
has
public
expired.
health.
No, you're lying to the American people.
I'm sorry, Madam.
You are lying to the
The
American
American
people.
people need to understand their health is at risk, and
Higgins,
this is a
Mr. Higgins is now
five-alarm
recognized.
emergency.
Mr. Higgins from Louisiana is now recognized.
Thank you, Mr. Chair. Today's hearing comes at a critical moment for public health and safety. All Americans should be able to trust that our government is working to ensure their food and medicine will be safe and affordable. But over the past 2 months, the Trump administration has purged thousands of FDA workers, putting this essential mission and American lives at risk. Last week, the administration purged 10,000 people at HHS, including 3,500 FDA employees. This was on top of a purge of approximately 1,000 FDA workers in February. And Secretary Kennedy subsequently admitted that 20% of last week's purges should not have happened. Tried to brush it off, saying, quote, we'll make mistakes, but how long will it take them to realize the full extent of the mistakes that they've made? How long will it take for them to try and very possibly fail to undo them? And how many Americans will get sick or die in that time? The FDA is supposed to make sure that our children have the vaccines they need to survive outbreaks of preventable diseases like measles, which has killed at least 2 children in the U.S. since February and sickened more Americans in 2 months than the entirety of 2024. The FDA is supposed to protect us from counterfeit drugs and contaminated infant formula, which are serious bipartisan concerns. But how is the agency supposed to stop dangerous illicit products from entering American homes and threatening American lives when underfunded food and drug inspection teams are being cut even more? 170 employees from the FDA's Office of Inspections and Investigations were reportedly let go last week. And let me tell you some of the expertise we're losing because of the administration's actions besides that. They fired people responsible for regulating e-cigarettes and ensuring that predatory companies cannot market vapes to children. They fired people responsible for monitoring drugs for side effects and updating warning labels. They fired the scientists monitoring bird flu and taking steps to prevent it from killing people. They fired the scientists with expertise in fighting heavy metals, toxins, and additives in our food supply. And they fired the people who monitor prescription drug shortages and ensure that Americans have access to affordable prescription medications. How is this making Americans healthier? We all know the answer to that question. It's not. People are going to die. And as a dad, I'm especially concerned by the administration undoing the progress we've made to protect babies from contaminated infant formula and formula shortages. And we should all be concerned by the risk posed by contaminated meat and produce. This chaos will keep us in the dark about looming shortages for essential drugs like antibiotics and chemotherapy drugs, and it will leave people no choice but to pay for pricey brand name drugs because there are no FDA employees to prove generic versions. In the name of efficiency, this administration even fired employees who were critical in approving new medications, meaning Americans will have to wait longer for new treatments, if they get them at all. And on top of that, we just heard last night from the president that pharmaceutical tariffs will be next, making the drugs we all rely on even more expensive. One of the Americans impacted by these cuts is one of my constituents, a former teacher who spent 35 years working at the Department of Education. She has idiopathic pulmonary fibrosis, a terminal lung condition that took her aunt's life and is slowly taking hers. It's a rare disease that doesn't get much funding, but she had hope. A drug to slow down the disease received the FDA's breakthrough therapy designation in 2022, and the trials show that it might actually stop the progression of her disease. Her doctor anticipated FDA approval this year, but the FDA's funding cuts and the firing of researchers and staff who sit on the approval committees have made this impossible. This administration is stripping both hope and life-saving medications out of the hands of Americans who need it most. The FDA can and must do more for Americans, addressing our country's chronic disease epidemic, ensuring our children are set up to live long and healthy lives, getting more life-saving medications to those who need them, and ensuring that food on our shelves is safe and wholesome should be at the top of that list of things to do. But rather than making it better, more efficient, this FDA is left ransacked and reeling from the chaos and destruction of the Trump administration. It's unclear whether the agency can even perform some of its most basic functions anymore. I don't know how much clearer I can be. These health cuts will kill people. They will make us less safe and less healthy. I was not elected to watch people suffer from diseases awaiting new treatments while this administration dismantles the offices that offer that hope. It's the responsibility of this committee to conduct meaningful oversight. If we're not talking about this and doing something about these cuts, we're not doing our jobs. I yield back.
Imagine, Ranking Member, that you were this, there was a major airline, and that major airline decided today that it was going to fire everyone except the co-pilots. And it was going to run that airline, and it only had the co-pilots. No pilots, the senior people are gone. People who fixed the planes were gone. People who got people on the plane were gone. That's what's going on at FDA today. I have major concerns. We are at risk. I think we are less safe today. I always believed that things were fixable. Right? I mean, that was when, I think we've seen that, right? You can always go in and fix. The problem is, especially in the sciences, I've been the dean of 2 major medical schools. This is about expertise. This is about pipeline. We're going to lose a generation of scientists. They're going to set back this country, and that's true at FDA. We've lost 1,000-person years of expertise in a few weeks. I don't think, if we let this go on for much longer, I think it's a matter of weeks. I don't think, this may not be fixable. This may affect us for decades. I have worked for both Republican and Democratic presidents. I was appointed by President George H.W. Bush and reappointed by President Bill Clinton as Commissioner of the FDA. We were responsible for accelerated approval, user fees, the food label, and the regulation of tobacco products. The FDA is a national resource. In January 2021, I had the privilege of returning to federal service and co-leading Operation Warp Speed. Mr. Chairman, I am in full agreement with you and share significant concerns about the safety and efficacy of illicit and sometimes licit drug products originating from overseas, particularly China. As you can see from the first graph, only 4% of active pharmaceutical ingredients, that's the key components of a drug, are produced in the United States. 80% are produced in China and India. In my opinion, for example, we have been conducting a reckless national experiment with compounded new weight loss drugs, the GLP-1s. Based on the information I've received from the FDA, it does not appear that there is routine FDA surveillance of the GLP-1s that are being imported into the United States from China for compounding to assure what is in the product. We cannot have confidence in the safety of compounded GLP-1 drugs. But that is only the tip of the iceberg. The conventional wisdom is that illicit cheap copies are coming from China. That has changed. The more significant threat, Mr. Chairman, is that China is attempting to surpass the United States in the sciences. As shown in the next figure, the highly respected Nature Global Index reveals that 8 of the top universities in terms of impactful research in the natural sciences are located in China. Specifically in chemistry, all 10 of the highest-ranked universities are in China. And only in the health sciences does the U.S. hold the lead. Do you want China to eat our lunch when it comes to science and innovation? We need to recognize that China is poised to surpass us in the sciences, and we need to quickly act to make the necessary investments to shore up our competitiveness and avoid putting our nation at risk. I know there are limitations in methodology. However, the U.S. scientists that I have spoken with increasingly see much higher quality work coming out of China. Look at the last figure. China is increasing investment in research and development, currently at approximately $500 billion as of last year. In contrast, our investment in the NIH increased only slightly from 2004 to 2016 and is now facing cuts. Whatever needs to be fixed, let's fix it. But we need to make a marked increase in our investment. I was a kid and went into the sciences after Russia launched Sputnik in 1957 as a result of our country's decision to be preeminent in the sciences. We are facing Sputnik 2.0 today, but with China. The current cuts to scientific research at the NIH and universities needs to be reversed. Otherwise, we are ceding the scientific primacy that Congress, over the last 75 years, has worked on a bipartisan basis so hard to ensure. One of the reasons we've been able to lead the world in health sciences is due to a strong FDA and its rigorous standards. One of my goals as commissioner was to ensure that if you needed access to a life-saving drug and you lived in the United States, you would have access to it before anyone else in the world. We saw that with COVID-19, for example, with the monoclonal antibodies. Those drugs appear to have saved President Trump's life back in October 2020. Dr. Peter Stein's office made that drug available to the President and thousands of others. Dr. Peter Stein was removed from office in the recent rounds of cuts, as were thousands of others. It is no way to restore trust in FDA when you cut the person who may have saved the President's life. These cuts appear to me as devastating, haphazard, thoughtless, and chaotic. Mr. Chairman, I agree with your priorities of increased enforcement against illicit imports and counterfeits. I agree with your priority of improving the safety of our food. The current cuts will make achieving those priorities impossible. We need to be clear-eyed about the threat that China poses to American exceptionalism, especially in the sciences. We can't afford to be haphazard in our support of American scientific enterprise, not when China's commitment to the sciences is more real than it has been in the past. The competition, America's real competition in the sciences, is China. The administration and Congress need to understand the nature of that competitive challenge and respond strategically, thoughtfully, and with appropriate strength. Thank you, Mr. Chairman.